All right, greetings. Welcome to chapter 9. This week is our last chapter for the Unit 2 exam, which will be next week coming up here, the week of October 28th, I believe it is. And this chapter is on alcohol. So we've been up to this point kind of talking about essential nutrients and important parts of our diet. Here we are now talking about something that is not an essential part of our diet, but does tend to factor into our lives quite a bit. So we are going to talk a little bit about alcohol. So as I said, alcohol is not an essential nutrient. It is ethanol or ethyl alcohol, which is a type of alcohol consumed in alcoholic beverages. Ethanol is safe for consumption, but it is considered a toxin by the body. It's safe for consumption up to a point. If you consume excessive amounts of ethanol, it will cause toxicity and can be fatal, which we'll kind of talk about a little bit later on. That versus methanol, which is a slightly different type of alcohol, and isopropanol or isopropyl alcohol. Those are also types of alcohol, but those are not safe for consumption in any quantity. They're both poisonous to humans. So methanol is what you would find in antifreeze, and rubbing alcohol is isopropyl or isopropyl alcohol or isopropanol. How you make ethanol is through fermentation, using yeast and bacteria and natural sugars that you find in fruit or in grains in the form of beer or wine. So yeah, beer is from fermenting grains, and wine is from fermenting fruits. Liquor is something, it's similar. It's an alcohol that we make from a process called distillation, which I've never distilled anything. I don't really know how it works, but it's basically creating very highly concentrated alcohol at much higher percentages than you would find in beer or in wine. All right, so that gets us to why do people drink? Why do people drink alcohol? And there's a lot of reasons why. I think culturally in this country, anyway, as far as the United States is concerned, it's one of those things that is pretty ubiquitous. You find it everywhere. People drink for lots of different reasons. So to relax, to celebrate, to socialize, to commiserate, to forget about a bad day or whatever. There's a lot of different reasons that people would drink alcohol. A lot of what we see for many people is a pattern of drinking called social drinking, where we find this acceptable in our society for sure. I guess depending on, your religious and cultural heritage, social drinking is considered in general acceptable. It's where, you would maybe have a drink when you go out to dinner with friends, have a drink or two in a social setting. And alcohol is not, we can't say that it's all 100% bad. Moderate alcohol consumption, which we'll get to the meaning of that in just one second here. Moderate alcohol consumption can potentially have health benefits, like reducing risk of heart disease. So what is moderate alcohol consumption, though? It's no more than one drink daily for adult women and no more than 2 drinks daily for adult men. So we're not talking about, multiple drinks every day, 1 to 2 like glasses of wine per day would be considered moderate alcohol consumption that could potentially have those health benefits of reducing risk of heart disease. So alcohol can increase HDL cholesterol and may make blood platelets less sticky, which can help with decreasing the risk of atherosclerosis, or the plaquing of your arteries, the hardening of your arteries that leads to, or that results from heart disease, or can lead to, heart attacks and things like that. However, moderate alcohol consumption, this benefit to your health has really only been shown in older adults and not in younger people. So women over over the age of 55 and men over the age of 45. This is where the health benefits come in. For younger folks, there has been no known or no evidence of health benefit from moderate alcohol consumption. So, you know, take that for what it's worth. All right. So again, moderate consumption based on number of drinks per day, 1 for women, 2 for men. But there's a standardized set of drink sizes that we don't always go by. So a standard drink is 12 ounces of beer, 1.5 ounces of liquor, and a 5-ounce glass of wine. So those are our standard drinks. So 1 drink is 1 12-ounce beer. 1 drink is 1 5-ounce glass of wine. So that's not necessarily what you are served when you order a drink at a restaurant. You're not necessarily served 1 drink, even if it's in 1 glass. It doesn't necessarily mean that it is considered 1 drink by these standard definitions. So pay attention to the size of the drink and the frequency of drinking. You know, abstaining for several days and then drinking a whole bunch on the weekends is still not considered moderate drinking. That's considered binge drinking, which we'll talk a little bit more about later in the chapter here. So here we have the difference there. A 12-ounce beer is 1 drink, but a lot of times you'll get kind of the pint glass of beer, which is actually 16 ounces, which is more than 1 beer. That is 1 1/3 drinks. Again, for wine, a 5-ounce glass of wine is considered 1 drink. If you have an 8-ounce glass of wine, that is a drink and a half. So again, drink size is a big thing to take into account when we are talking about moderate drinking. All right, these are our standard drink sizes: 12-ounce beer, 5-ounce wine, 1.5 ounces of liquor. All right, so what does alcohol do in the body? Well, alcohol is a toxin, even ethyl alcohol that we consume. And your body works really hard to get rid of it, to metabolize it and get rid of it. You know, alcohol starts to be absorbed through your stomach, which is unlike most of our other nutrients. Most of our other nutrients wait till they get to the small intestine to be absorbed. Alcohol begins its absorption in your stomach. But your stomach produces an enzyme called alcohol dehydrogenase, and it begins to metabolize that alcohol before it's ever absorbed into your body, which is nice. However, if you are biologically female, you have 20 to 30% less alcohol dehydrogenase in the stomach, and therefore cannot eliminate as much of it before it gets absorbed through the stomach. So 20 to 30% less alcohol dehydrogenase means that women are more susceptible to the effects of alcohol than men are, because more of it will get absorbed into our bodies. And we'll be looking at a chart about there's some differences in the weight of the person as well as the sex of the person. So that would also account for the fact that women, for moderate drinking in women, it's considered 1 drink a day. For men, it's considered 2 drinks per day. They just have 20 to 30% more enzyme in the stomach that can neutralize the effects of the alcohol before it ever gets absorbed. What else will kind of help with that? If you have food in your stomach, it slows the alcohol absorption. And the majority of the alcohol does get absorbed in the small intestine. So about 80% of it is absorbed in the small intestine. But for men, less of it's going to make it out of the stomach into the small intestine because of the fact that the alcohol dehydrogenase begins immediately to break it down. Metabolism of alcohol primarily happens in the liver, which is why the liver is affected most by overconsumption of alcohol. Your liver can metabolize 1 standard drink in about 1.5 hours to 2 hours. So a 5-ounce glass of wine, the liver can get rid of that in roughly 1.5 hours to 2 hours. So what happens with our enzymes, our alcohol dehydrogenase, it converts the ethyl alcohol or the ethanol to acetaldehyde, which eventually gets all the way broken down into carbon dioxide and water. And then if you kind of have chronically high levels of alcohol present in the liver, there's another set of enzymes called microsomal ethanol oxidizing system, or MeOS, that will try to work to get rid of the excess amount along with the alcohol dehydrogenase. So, and again, that's, you'll only really see the MeOS working when you have chronically high levels of alcohol in the blood and in the liver. All right, so as the alcohol circulates in the blood, it's going to do so until it reaches the liver, and the liver can fully get it metabolized and break it down and make it, non-toxic to the body. So one of the things that I'm sure we've all heard of is blood alcohol concentration, or BAC. That is what we look at to determine if someone is drunk, I guess, or over the legal limit of alcohol in the blood. And we estimate that by having someone blow into the breathalyzer machine. The amount of alcohol coming in your breath is approximately equivalent to how much alcohol is floating around in your blood. And the legal limit for operating a motor vehicle is 0.08. So that's our 0.08% blood alcohol. All right, so here are the tables. How many drinks per hour until you are at or over that legal limit, or what your blood alcohol concentration would be, consuming a certain number of drinks per hour. And again, there's a table for women and a table for men. And again, you'll notice that there are different levels based on weight of the person. So the smaller the person's body, the more quickly you reach that legal limit, that high level of blood alcohol concentration. So let's say that you weigh 140 pounds, you could potentially have 2 drinks in an hour and still be very slightly under 0.08 in terms of your blood alcohol concentration. So you can kind of read through that. The higher the numbers down here, the more likely you are to have really bad alcohol poisoning and potentially die. So you want to stay more toward the lower end of the spectrum there. And here's the one for men. So the equivalent 140-pound man could still have 2 drinks per hour, and their blood alcohol concentration would be 0.05. So it would be, like 2/100ths less than it would be for a woman. Again, because of that difference in the alcohol dehydrogenase levels in the stomach and so forth. All right. So what does alcohol do in your body? Well, it is a central nervous system depressant. It depresses your brain, which is where we get a lot of the effects of alcohol on the body. It's why it makes you like calmer, usually, why you think it helps you to relax and things like that is because it's depressing your nervous system. It lowers your inhibitions. It also decreases your reaction times and does a lot of, it impairs your mental function and your ability to make good choices. So slows down transmission of nerve impulses and reaction time, which is why we have a limit to how much alcohol one can consume and still be able to safely drive a motor vehicle. It impairs your thoughts, actions, and behavior. So again, it dulls your inhibitions, something that you might not do when you are sober, you might feel comfortable doing when you've had a few drinks and so forth. And the more you consume, the more areas of your brain are affected. If you consume enough, it will affect your brain stem, and your brain stem is the part of your brain that controls all of those like automatic rhythmic activities like breathing and heart rate and blood pressure and all of those kind of things. So if your brain stem is affected and suppressed, you can no longer regulate your body, and you could just stop breathing and die. So yeah, so if you consume enough alcohol to affect your brainstem, that is when you are in serious danger of death. So here's the effect of different blood alcohol concentrations on the brain and on your function. So under the legal limit, 0.01 to 0.05, you might feel a little more relaxed, loss of inhibition. It's mostly affecting your cerebral cortex. You know, so it's kind of the higher level function of your brain, not so much the housekeeping stuff that keeps you alive, but more, you know, your thoughts and your behavior and all of that is affected. So you might have some impaired alertness or impaired judgment, even with small amounts of alcohol, with a lower blood alcohol concentration. Moving up the scale, again, you can kind of read through these on your own. I won't read all of them to you, but by the time you get to roughly the legal limit of alcohol, the cortex and the forebrain are being affected. So your coordination, your fine motor skills, your visual tracking, all of that kind of stuff goes out the window, and you're not safe to, not really safe in a car. You could definitely cause yourself harm or other people as well. And then by the time you get to those really, really high levels, 0.31 to 0.4, you could be, you'll be unconscious. You could potentially be in a coma. You could also die. Your whole brain, including the brain stem, is being affected there. Your bladder control, your breathing is erratic and maybe too slow. You know, so again, death can occur. 0.41 or greater, your heart is going to be affected. Controlling your heart rate is going to be affected, and you could again potentially die. All right. So what are the harmful effects? How can alcohol be harmful? Well, I know people think like, I'm really stressed, I'm going to have a drink before I go to bed. It's going to help me sleep. It doesn't actually. Alcohol disrupts your sleep. It makes you sleep more in the REM stage, which is a light type of sleep. You don't really get into the deep, slow wave sleep that is restorative and regenerative to your body. So you don't get the quality of sleep that you would get without the alcohol. They can potentially contain chemicals that lead to these kind of hangover symptoms. And if you've ever had a hangover, you'll kind of know what the hangover symptoms are: headache, fatigue, nausea, increased thirst, rapid heart rate, tremors, sweating, dizziness, depression, anxiety, irritability, just feeling really off and feeling really gross the next day. And part of that can be due to those chemicals that are potentially in alcoholic beverages, but also alcohol is a diuretic, which means it causes you to produce more urine. It shuts down your body's ability to kind of reabsorb water from your kidneys, and it all goes out as this high high volume of dilute urine. And you know, that can lead to dehydration, and dehydration makes you feel really crappy. So you know, some of those effects of hangover definitely are the effects of being dehydrated and potentially having electrolyte imbalances as well. Alcohol interferes with different hormones potentially, especially insulin and glucagon, and that can mess up your blood glucose levels. It can negatively impact your parathyroid hormone and hormones that help strengthen your bones, help put more calcium and phosphorus in our bones to make them stronger and harder, which increases your risk of osteoporosis and fractures from osteoporosis. It can increase estrogen levels in women, which if you have particular kind of genetic mutations, can increase your risk of breast cancer from too much estrogen in your system. And it can obviously affect reproductive hormones associated with both males and females and lead to sexual dysfunction. We all kind of know, if you've had quite a few drinks, things don't really function in the sexual department particularly well. So it can impact sexual function as well. As far as nutrition is concerned, alcohol can impact our nutritional status. It can lead to either overnutrition and also malnutrition. Alcohol is not calorie free. It provides 7 calories per gram and can contribute to weight gain because you are just, drinking these empty calories that aren't really doing anything for you. They're not providing essential nutrients. They're just adding calories to your diet. Increases fat and weight around the stomach, so that abdominal adiposity or the belly fat. We used to call that like the beer belly. The older guys that would drink, quite a bit of beer would have a little bit of a gut on them. The beer gut or the beer belly, that's because of the increased weight around the stomach. And then, if you're drinking a lot of alcohol, that may also replace nutritious foods in your diet. So drinking, but not eating the important nutrients and things like that. So alcohol also interferes with absorption of a lot of important vitamins and minerals: zinc, magnesium, thiamine, folate, and vitamins B12, A, D, E, and K. And deficiency in those vitamins. Obviously, we went through a vitamin chapter recently. You can refer to that to see what those vitamin deficiencies could potentially, how that could impact your health overall. We know alcohol can harm our digestive organs. So you can get inflammation in the esophagus. It can lead to increased risk of cancers of the mouth, the throat, the esophagus, stomach ulcers, and gastritis. Gastritis and itis is inflammation of something. It's inflammation of the stomach. Hypertension, so high blood pressure leading to damage to your heart potentially. Alcoholic liver disease. So alcohol, like we said, is detoxified by the liver. And as we drink a lot of excess alcohol, it begins to impair the function of the liver. So you start there's 3 stages. The first one is fatty liver disease. Then you have alcoholic hepatitis. Again, itis is inflammation. So alcoholic hepatitis is inflammation of the liver due to alcohol consumption. And then cirrhosis, which is essentially scarring of the liver. So we can kind of see a picture here. Normal healthy liver. B is the fatty liver. So you can see how light colored it is and kind of shiny it is from kind of fatty infiltrate. And then the final one is the cirrhotic, scarred, non-functional liver that we've done permanent damage to the liver at that stage. Now the fatty liver, you can get fatty liver after just a few days of overconsumption of alcohol. So it's like you have a big weekend and you do a ton of drinking on the weekend, you could potentially lead to some fatty liver. Now that's reversible, provided that you change, your activities and clean things up and drink less alcohol. But cirrhosis, like I said, is scarring of the liver. The liver becomes non-functional because of all that scarring, and there's nothing you can do that is irreversible. All right, let's see. Pregnancy, we know alcohol and pregnancy do not go together. Exposure to alcohol prenatally can lead to a variety of different disorders. It's on a spectrum. We call it fetal alcohol spectrum disorders, or FASDs. The most severe one is what we call fetal alcohol syndrome, and it impairs physical, mental, and behavioral development in the fetus. So when they're born, they have some like physical anomalies, potentially mental anomalies where they have, sort of developmental delays and like, I guess, for lack of a better phrasing, like lower IQ scores and all of that kind of stuff. And then kind of behavioral abnormalities in the sense that they kind of are like a little ADHD kind of hyperactive and have difficulty regulating their emotions and things like that. The effects of that are permanent. And I know, from culture to culture and kind of colloquially, you might hear people say, well, I drank a glass of wine, at dinner every day when I was pregnant, everything came out fine. In Europe, it might be more common to drink wine or have, some moderate alcohol consumption during pregnancy. But, the only proven safe amount of alcohol during pregnancy is zero. Zero alcohol for the duration of the pregnancy. That's the only way you can really guarantee that you're not potentially putting your fetus at risk of, health, mental health, physical health, and behavioral abnormalities that they would deal with for their entire lives. So the only proven safe amount of alcohol during pregnancy is zero, no alcohol. These are kind of the physical signs of fetal alcohol syndrome. So you have kind of an extra fold of skin over the eyelids. It's called an epicanthal fold, making the eye look a little bit more kind of almond shaped or more narrow. Not much of a nasal bridge there, a small kind of upturned nose, small head circumference, small eye openings that are wide apart from one another, thin upper lip. So there's a variety. Those are just sort of the facial, I guess the facial feature differences that you would see in someone with fetal alcohol syndrome. And then on top of that, you would see the mental and behavioral effects as well. All right. Looking at alcohol and advertising, so I think, there's a lot of advertising in media, in magazines, on TV, all of that kind of stuff. There's a lot of money spent annually in promoting alcohol ads. So like in some studies, they showed that like Sports Illustrated, the ads for alcohol outnumbered other ads not related to alcohol 3-1. So, and what impact does that have? We might not think it has a lot of impact, but it does definitely on adolescents and underage drinking. So studies have shown that seeing a lot of advertisements for alcoholic beverages has shown an increased level of drinking in some adolescents. So adolescents are maybe like more susceptible, I guess, to the effects of the advertising. And all the advertising, if you look at any alcohol ads, it's all people having like the best time. It's those like really young, really attractive people just having the greatest time of their lives. And when you're young, you think like, well, I want to do that. It must be really fun to drink alcohol. And you maybe fall into that trap. So where maybe you might not think of the effect of alcohol advertising, it is potentially there. All right, so we're going to get into what we may have previously called alcoholism. We're going to talk about alcohol use disorder. It kind of takes the onus off a little bit of the stigma away from the term alcoholic. Alcohol use disorders are it's again a continuation of over consuming alcohol, even though there are obvious negative impacts to your life. So they've created social, psychological, and or physical problems for you, and you continue to consume alcohol, even in the face of that. So again, it's kind of a spectrum of different disorders here, but one type of it is binge drinking, which I think is very, very common on college campuses. It kind of has been for a long time. So what do we consider binge drinking? That's the consumption of 5 or more alcoholic drinks by men or 4 or more drinks by women in a short period of time. And what do we mean by short period of time? In the course of a couple of hours probably would be considered, a short period of time. other types of alcohol use disorders are like underage drinking, drinking and driving. Those are also considered, potential repercussions of these alcohol use disorders. So there is a little survey here, and you can take this for yourself if you want to, and just kind of go through and see how many of these might apply to you or might apply to somebody that you know. But this is a list of questions that basically are yes or no questions. In the past year, have you done any of these things? And you'll keep track of which ones that you mark yes for. And we'll keep going there. You can kind of read through those, like I said, on your own. And there are 11 questions. When we look at how to interpret this, if you said yes to 2 or 3 of the symptoms, you potentially have a mild type of alcohol use disorder. If you have 4 to 5 of them, it would be moderate, and 6 or more would be a severe version of alcohol use disorder. So like I said, those are things that you can take a look at for yourself, and see whether any of those really are applying to you. If you have one of them that, doesn't, I guess, qualify on the spectrum of alcohol use disorders, but 2 to 3 symptoms would be a mild form, and on up from there. All right. So what happens when we binge drink? Again, binge drinking, consuming 4 to 5 drinks in about 2 hours, is considered binge drinking. It increases a lot of negative impacts, right? So increased likelihood of injuries and car accidents, drowning, unplanned sexual activity, and death. It's associated with a lot of stuff, fights and sexual aggression, assaults, suicide, homicide, child abuse, all kinds of things. And then also general health problems like high blood pressure, heart attacks, and then STDs, because if you're not planning on having a sexual relationship with someone or having engaging in sexual activity, you maybe aren't prepared with condoms or protection to prevent transmission of sexually transmitted diseases. Binge drinking can cause blackouts where you don't remember what you were doing, and can lead to alcohol poisoning, wherein you could potentially die from overconsumption of alcohol. And then chronically doing this over a long period of time leads to increase in alcohol tolerance, which means that you become less sensitive to alcohol and need more and more to get the same intoxicating effect. So, continuing to drink, and drink a lot more in order to feel that buzz. All right. Consequences of college binge drinking. This one shows a lot of assaults, physical assaults there, sexual assaults, and deaths. And this is number of college students 18 to 24 per year that have experienced this due to excess drinking. All right. Moving on to our other types of alcohol use disorder, drinking and driving. If your blood alcohol content is over 0.08, it is illegal for you to drive because of your impaired alertness, judgment, coordination, all of that stuff that we talked about previously. So that is also considered like a type of alcohol use disorder. And then we have underage drinking, which any drinking of anyone under the age of 21 is considered an alcohol use disorder. What are the impacts of that? Risk of violence, injuries, and health impacts, increased risk of those. It can also interfere with the development of your brain. Your brain does not finish fully developing until you're like between 23 and 25 years of age. So drinking early on when your brain is not fully formed, can lead to a lot of impacts later on in life, cognitive and memory damage in teenagers, younger folks whose brains have not fully developed. It's also, underage drinking and driving obviously is the same as people older who are drinking and driving, except you have people that are already less predictable and less experienced behind the wheel, and now they are also drunk. So that is a problem. And then the earlier in life someone starts to drink, the higher the risk of them having, you know, a more severe form of alcohol use disorder later in life. So I guess the more likely you are to develop kind of a dependency on alcohol. All right, so what do we do if we suspect that we have an alcohol use disorder or someone we care about has an alcohol use disorder? Well, if you have a more mild form of alcohol use disorder, getting help from your family doctor, just talking about it with your family doctor might be enough really to help you reduce alcohol consumption. Your family doctor or a therapist could maybe talk you through making a plan to lower your consumption of alcohol. Those who have more severe forms of alcohol use disorder probably need more specialized counseling, rehab or AA or programs like that, where they can specifically focus on your triggers and how to navigate the world with some help from long-term ongoing support from a sponsor and going to meetings and all of that kind of stuff. All right, moving into kind of one of our last little topics here, who should not drink alcohol? So under the dietary guidelines for Americans, which we talked about at the beginning of the semester, there's some people that should completely abstain from drinking. So it says women of childbearing age who may become pregnant. I would just say that puts, the responsibility on the woman. Yeah, she's going to carry the pregnancy, but I also think responsible drinking if you are of childbearing age and not actively trying to become pregnant. It's okay to have a drink once in a while, but if you are pregnant, you want to not drink at all. Anyone under the legal drinking age, under 21, should not drink. People who take medications that alcohol could interact with, and that includes prescriptions and over-the-counter medications. You want to avoid alcohol while on those medications. If your doctor tells you not to drink when you're on a medication or because of a specific medical condition, follow the advice of your doctor, obviously. And then if you're doing something important that requires your attention, your fine motor skills, your good judgment, no alcohol there. And then people who really can't control their alcohol intake probably should abstain from drinking, period. If you're one of those people that, has one drink and then, later on that evening, all of a sudden you've had 12 beers, that's someone who really can't control or restrict their alcohol intake and should, again, seek help for that and also abstain from drinking any alcohol. All right, that ends the chapters. This week there is a little set of questions on the discussion board for you to take care of, as well as your normal weekly homework assignment. That should be about it for the week. And then next week, the exam will open up on Monday and be due on Sunday. So be working on your study guide as well.